Severe sepsis is a medical emergency and it's estimated to cause around 40,000 deaths per year in the UK. We know early recognition and prompt action of severe sepsis can save lives. So what can you do to reduce deaths from sepsis at the Royal Surrey? Make sure that you're familiar with the adult sepsis pathway. This guide has 3 components: early recognition, prompt resuscitation based on the delivery of the Sepsis 6 care bundle within an hour, and referral if any signs of organ dysfunction are present. Recognition of severe sepsis is based on physiological variables. So, what are the triggers for action by you? An early warning score of 3 or more means you must start the sepsis protocol. You should call the outreach team and assess for a systemic inflammatory response syndrome. If there's evidence of infections, such as a cough or dysuria, then this is sepsis. For patients who've received recent chemotherapy or are taking immunosuppressants, a higher index of suspicion is required. Remember, not all patients with sepsis will have a raised temperature. Tissue hyperperfusion, such as poor urine output or skin mottling, is also consistent with sepsis. If you think your patient has sepsis, dial 2222, state "sepsis team required" and start the Sepsis 6 bundle. If you recognise the source of infection, treat it, following antibiotic guidelines. These can be found on the MicroGuide app, which is on every desktop computer in the hospital and is easily downloadable on your phone. If the source of infection is unknown, treat it empirically, as instructed by the MicroGuide app. Remember, delivery of antibiotics within the first hour is the single most important component in reducing deaths from sepsis. Give oxygen to the patient and fluids if they have a low blood pressure. Importantly, please time delivery of the Sepsis 6 bundle on the sheet and complete delivery within 1 hour. It is very important to review the patient with a senior doctor at 1 hour and put in place a care plan with further reviews. Any evidence of organ failure should prompt you to refer to intensive care. Remember, the steps that you take in the first hour can have the greatest impact and benefit. Delay can result in death, so please recognise, resuscitate and refer.